I've been recently posting about my little case studies talking about the Zepbound or Wegovy Blahs when people are at the highest dose, and when I lower them, they tend to feel better. But on average, most of my patients feel much better on these drugs or neutral, increasing energy and all sorts of stuff. So it's nice that we actually have a systematic review as opposed to just my little anecdotes. In fact, one of my patients just asked me, "Do we know if these things have an effect on mood?" And she looked up ChatGPT, and apparently it quoted me in one of my videos, which let's actually use, studies, not my little videos, even though I appreciate the sentiment, ChatGPT. We already know biologically these GLP-1 receptor agonists modulate the neurotransmitters, change the neurotransmitters and cytokines, and they have an effect there. So mechanistically, we know these drugs probably do have an effect. And we have trials showing those with depression, anxiety, are it's safe to use these medicines and monitor them closely, of course, but they are able to lose weight with these medicines. In general, though, they found that there's a beneficial effect on mental state. And I think as a group, anybody watching this that takes the medicine could probably say that. Again, I have the cases where people are on high doses and they kind of have a worsening or dampening of their mood. But in general, we do see a positive effect. And of course, I've published actually some data on our patient populations. And we all know this already that there seems to be an effect on alcohol and other addictive like behaviors. But one of the things is there is a worry about suicidal risk. Looks like there may be a protective effect on suicidal risk. And that whole thing has kind of been debunked, although it's something we monitor. I did see one person out of tens of thousands that I was overseeing have a potential effect from the drug on suicidal ideation. So, something you always want to monitor. In the end, I agree with their conclusions. Don't just take my word for it and anecdotal data, although I appreciate it. We should be looking at randomized controlled trials, looking directly at this, placebo blinded trials, so that we can see the effect and know, as opposed to just yeah, it seems like there's an effect. No, we need to study it.